My name is Mason Bailey. I have a mom, a dad, a sister, and a little dog named Max.
When you look at Mason, how he acts, how he talks, his physical activity, you wouldn't know that there's anything different with Mason.
I like to build things, make movies.
Oh, cool. The hat came back with me. I'm gonna go grab a sandwich.
The only difference I see is I get a little more tired than the average sixth grader. I was born without a pulmonary that sends blood from the heart to the lungs.
I came to Cook Children's in 1999, and so shortly after I came, Mason was born, so I've been treating him pretty much as long as I've been at Cook Children's.
He was born on Easter Sunday in the year 2000. On Tuesday, they took him back to have a circumcision, and so immediately after that, he turned blue.
Mason was born with a congenital heart problem called pulmonary atresia. He just couldn't get blood to his lungs, and then he had a large hole called a ventricular septal defect, or a VSD, on the inside of his heart as well. The only way they really get blood out to the lungs is through a little blood vessel that all babies are born with. And the problem really occurs is when that little extra blood vessel that all babies have starts to close like it should a few days after birth, then you won't have any blood going out to the lungs, and then the babies get very sick and even can die with this condition.
For a lot of babies, it's possible to just go in and do surgery and to fix their heart. For Mason, that wasn't possible. So we gave him a shunt, which is just a tube from the body artery to the lung artery to allow adequate blood flow. This allowed him to come off of medication and to be able to go home with saturations that were in the mid-70s. There are some families that you feel close to, and you consider them to be friends. And Mason's family is that type of people. And I think the day when he had his operation, and he was pink for the first time, was probably almost as exciting for me as it was for his family.
We absolutely feel like Dr. Roten is part of our family. She's been with us since day one, and we enjoy coming to see her every year.
Dr. Roten is very sweet, very kind. She feels like a part of the family, really.
Mason's had 3 heart procedures, and they have done a good job of basically, as they described it to us, sort of correcting his heart to function more like a normal heart. Put in things that he wasn't born with, and his heart now functions more like a normal heart. So now we're looking at this new procedure that he may be a candidate for called the Melody valve.
We all know that before they become a teenager, they're going to outgrow the valve that we put in, even if everything else is fine. But you look at Mason and how much growth he has, and I know that putting a valve in him now, being a big enough valve that he's not going to outgrow it, would be very difficult in his size.
There's really 2 options over time, and that is surgical replacement of the valve, or in the case of what's available now, which is relatively new innovation, is Medtronic's Melody valve, which we're able to put a catheter up into that area, balloon dilate it, and actually place a valve within a stent, a valve similar to what had to be surgically implanted the first time.
It puts off another big surgery for him, and so that's the benefit. And so it wasn't even mentioned or available 10 years ago when we first started with this with Mason, and so now here we are looking at this new procedure, and that's very exciting for us. And the research and the support the American Heart Association has given to congenital heart problems has certainly benefited us over the years.
The American Heart Association has donated so much money to coming up with ways to make these kids' lives better. The fact that these people are able to know what's out there, to make decisions even when they're kids and not be scared about it, is pretty amazing.
In our generation, we certainly relied on the website probably more than printed material.
Exactly.
And all the research and studies and statistics and things like that are there, and new research initiatives and where things are headed.
They really gather the information, they gather the experts, they put the information together to help really guide and enhance the quality of care that pediatric cardiologists are providing. And when you think of giving to the American Heart Association, you're really giving kids who were born without a chance to have a life, to have a normal life, for something that there used to be no answer to.
You don't really realize, the breadth of the people that you're helping when you make a donation. The American Heart Association covers babies to adults. They do great work, and without their support, it'd be really difficult for us to be where we are now, where we can take a baby like Mason, who not too long ago would have passed away, and make him be a happy young man.
We feel that it's very important to give to the Heart Association to continue the research.
that's why we want to keep pushing, so that in the future, folks that don't have hope for some conditions, that they're able to find that hope through procedures just like we did.
Oh, they've really helped me out a lot. Everyone working there that's had fundraisers to raise money to help Cook's children with new research, to help kids just like me. Glad I'm still alive today. It's thanks to you and the American Heart Association.
Are you going to be the next Steven Spielberg?
Maybe. Hoping for George Lucas.